Larry Bell, columnist at Forbes.com, professor at the University of Houston. Professor, thanks for your time, sir.
Well, thanks. Thanks for having me on.
You bet. Your latest piece, Why the Centers for Disease Control Should Not Receive Gun Research Funding. Now, we have heard, of course, by a lot in the mainstream media that the uber-powerful NRA put a stop to any research regarding gun control back in the 90s, and this is one of the things that President Obama said, that the CDC needs to start doing research into gun violence again. You say no. Why?
Well, first of all, thank God for the NRA. As we all know, whenever you have a contrived crisis, it's a great opportunity to enact all kinds of legislation and executive orders and so on. So playing on the emotion, the president came out and said, "Gee, we need to really fund, research into, the gun issues and so on." So the notion is, and he specifically issued an executive order saying we should, the Congress should fund the CDC to do this, and this was done once before under the Clinton administration, and it was a total disaster, as you probably remember. CDC went out and, as instructed by any regulatory organization, came back with exactly the story that the government wanted, which is that guns cause all kinds of alarming problems, and households that have guns have umpty times more chances that someone who's in the household will be killed, or there'll be added suicides and so on, and all that stuff was bad research. And I think the largest issue is an attempt to tie gun violence and the guns themselves to a disease, a pathogen. And so, of course, if you get rid of the pathogen, get rid of the disease, i.e. the guns, then things can be a lot better.
Yeah, and so it seems like part of the problem here, Professor, is that they're going into this research with the idea of, all right, so how do we make guns look bad? Or even just how bad are these results going to be? But the supposition is always that they're going to find out that guns are bad, right?
Well, that shouldn't be any big surprise. From the very beginning, it was a preconceived notion that this was going to be the outcome. For example, all of these studies since 1985 had reached the conclusion that we need stricter gun control. And why is that? Well, ever since 1979, the whole goal of CDC's parent agency, the U.S. Public Health Service, has been, and I quote here, to reduce the number of handguns in private ownership. And that was to start with a 25% reduction by the end of the past century. So that was always the agenda. And so getting those results back should be no surprise.
So, one of the other things, Professor, is that there again is this sort of assertion that there's not been any research conducted after the CDC stopped doing it. But there have been more studies done. And in fact, there was a big review a few years ago, National Institutes of Science, I believe, that looked at over 20 studies. And their conclusion was that, well, we need more research. But there was a dissenting opinion from someone who was on the panel, and he said, look, we didn't find a single study that indicated that these gun control laws are effective. And we found a lot of studies that found things like right-to-carry laws are effective in reducing crime. I don't think we need more study. I think this was a wishy-washy conclusion, and really what the conclusion should have been is that these gun control laws don't work, and people should have the right to keep their arms because it is effective at reducing crime and saving lives.
Yeah, and there's a parallel here that may not strike all of the listeners, but probably will some. I can't help but compare this with the global warming nonsense, where you have EPA and these other organizations sponsoring studies of the whole global warming issue, and you got the Intergovernmental Panel on Climate Change and so on, and of course they come back with all kinds of alarming stuff about gosh, we're killing the climate. So the solution is that has become more than a $5 billion science industry. And so you can imagine that a lot of the social scientists in particular aren't really excited about having their funding cut, because it's that's another rice bowl that was emptied for them. And the government, when they sponsor research, and particularly a regulatory organization, they get what they pay for, and that's just very obvious.
So where do you see this debate headed, and what do you think President Obama's executive actions will do? I mean, will we start seeing the CDC pump out more of these anti-gun studies?
Well, that's up to Congress, and that's up to the House. They control the purse strings, and they cut it before, and with very good reason. And I certainly hope they do it again. And I think that NRA and other organizations should work very hard to make sure that happens. That people don't see this as just some kind of innocuous, oh, sure, we need more research to understand the problems. That's not the issue. This is basically to create a propaganda platform so they can build some public support for more regulation. That's all it is. It's all it's ever been. And putting this under the regime of a disease or a public health issue. The public health issue we have is a large number of people children being born out of wedlock, and the inner city drugs and so on. Those are the social disease that needs to be addressed, and to put this in the hands of a health organization that's supposed to be looking at real diseases, I think is just a travesty.
Larry Bell from Forbes.com. Thank you for your time this afternoon, sir. Good talking to you.
Well, it's always a pleasure. Thank you so much for having me.